So imagine suffering a medical emergency at home and having to wait more than 25 minutes for an ambulance to arrive. That time could be the difference between life and death. And this is the situation facing millions of Americans living in rural ambulance deserts. So Mayor Terrence Windham is joining us now. He leads the city of Aliceville, Alabama, where residents have limited access to emergency services. And we should say, what is an ambulance desert? It's when, the closest ambulance is about 25 minutes away. Your town is an example of what we've been seeing happening across the country. Now, according to Wikipedia, and I know they say never use Wikipedia as a source, but your town is 36 miles west of Tuscaloosa with a population of just over 2,000. It says 2,117. And it seems like kind of the turning point for your community when it came to getting the emergency care that is needed is the closure of a medical center in a nearby town. Can you tell me why that happened, why the medical center closed, and then what were the immediate repercussions that you saw for your community?
So again, I want to say thank you again for having be here to be able to speak on this topic. Ambulance deserts and medical deserts are a devastating thing that is happening in our rural communities. Specifically for us, take your mind back to 2020. We had this is pre-COVID. There was a lot of talk about the hospital closing, and unfortunately, about 2 weeks before the national emergency was declared in March of 2020, that's when our ambulance service, not ambulance service, but our hospital closed. And when that hospital closed, it closed at the height of COVID-19.
Wow.
So there were many hundreds of people in our county that suffered, some that even passed away. So the issue that we're having is specifically lack of medical care. 25 minutes is actually a great time. Typically, an ambulance service in our area of the county would take you about an hour to 2 hours to get ambulance care.
So, often what we have been seeing in rural America is you have these smaller medical facilities, and they just can't stay afloat. It's difficult to make money. It's tougher and tougher to pay the bills. And so as they close, then these ambulance services also don't have kind of a location as their home base.
Absolutely.
So, you have been fighting for your town, and there was an $8 million, originally $10 million proposal in the state budget to revitalize the hospital. But the state
Right.
Senate, scuttled that at the last minute. What happened? You would think that state lawmakers in Alabama, of all states, would have a keen understanding of the needs of rural America. Is there a
Right.
disconnect?
So I believe there was absolutely a disconnect. Going back to your original topic, Alabama is one of the states that has not received the additional funding for expanding medical care
Mm.
and expanding Medicare. So the issue that we have is we have some politicians who are looking at this as a political issue
Mhm.
instead of looking at it as an American issue. What happened in Montgomery, Alabama, was we lobbied with the governor. We spoke directly with her financial advisors. That money was put in by the governor in her proposed budget. It made it through the legislative house. Republicans and Democrats alike accepted that deal. They cut it down by about 2 million, but hey, that was great. That was a great starting point.
Mhm.
And the issue came in when politics came into play, when it went to the Senate House or to the Senate floor.
Mm.
And unfortunately, our senator did not vote with the community and decided to take away that funding to place it in a port in the Port of Mobile, which the Port of Mobile is
Mm.
great, but we need healthcare. And specifically, if we say that we are a state that looks at life and protects life, because as a state, they're against abortion and
Right.
those type things. It seems as if they would be keen on trying to help the people that are living as well.
Right. So then what is the solution? What do you need to see happen?
So what we need to see happen specifically, we've already spoken with our legislators and let them know we're not going to accept this going down. We know that we have members of the House that are on our side. We've spoken with the senator who voted against it in the state of Alabama that represents our community and area. And there was a meeting of about 400 residents, and all those residents had fury in their eyes as people die on the street. We actually had a young woman who died 5 minutes away from the hospital,
Jeez.
um, because she did not have the adequate medical care. Now, could she have lived? Could she have not? Who knows? But at least she would have had a chance. Animals have a hospital in Pickens County, but people do not. So, what we've done, we've continued to lobby in the legislative forum. The session starts back in January, and we plan to be active on the Senate floor. We've already spoke on the Senate floor about a number of other issues, but I think that we're going to get some good traction this year or next year.
Well, Mayor, it certainly sounds like you are fighting for the folks in your community, and I wish you luck. Mayor Terrence Windham, thank you very much.
Thank you for having me.